Every morning, your heart faces its highest risk window of the entire day. Not during exercise, not during stress, not during sleep. The first 60 minutes after you wake up. Here is what the research shows. In the hour after waking, your body triggers a coordinated biological surge, cortisol rises sharply, blood pressure climbs, heart rate accelerates, blood clotting factors increase, and the cardiovascular system shifts from its overnight low-demand state into full daytime activity, all within minutes of opening your eyes. For a healthy heart with flexible, responsive blood vessels, this transition is smooth. The system handles the surge without incident, exactly as it was designed to. For a heart that is carrying years of unaddressed cardiovascular risk, stiffened arteries, elevated resting blood pressure, plaque in the coronary vessels, a history of arrhythmia, that same morning surge creates a window of measurably elevated vulnerability. Research associated with Harvard Medical School has found that heart attack risk is roughly 40% higher across the entire 6 a.m. to noon window compared to other times of day. And when you narrow that down specifically to the first 3 hours after waking, the relative risk climbs to approximately 3 times higher. Not slightly elevated, substantially elevated, and that window opens every single morning, whether or not you are aware of it. Now here is what makes this relevant to today's conversation. 5 common morning behaviors, things that most people do without a second thought, can amplify that natural cardiovascular surge significantly. They don't create risk from nothing, but for adults over 60 who are managing blood pressure, heart disease, arrhythmia, or simply the accumulated cardiovascular changes that come with age, they add unnecessary stress to a system that is already navigating its most vulnerable daily transition. And 5 simple adjustments, none of them difficult, none of them requiring medication or equipment, can meaningfully reduce that stress and support the cardiovascular system through the morning window more safely. My name is Dr. William Parker. I have spent 21 years specializing in senior health, and today I'm going to walk you through both sides of that equation, the 5 morning behaviors that elevate cardiovascular risk and why, at a biological level that makes complete sense once you understand it, and the 5-step morning protection routine that the evidence supports as a gentler, safer way to start the day after 60. Stay with me through all of it. The 5th morning behavior is the one that surprises people most because it involves something increasingly popular that is often promoted as healthy. And the final step of the morning routine is the one that ties everything together in a way that takes less than 60 seconds but addresses the underlying mechanism that makes the whole morning window dangerous. This is not about fear. It is about understanding what your cardiovascular system is doing when you wake up and making 5 small choices that work with that biology rather than against it. If this channel is new to you, subscribe now. This is what we do here, calm, evidence-based guidance for adults who want to protect their health with information that is accurate, practical, and respectful of their intelligence. Let's get into it. Before I walk you through the 5 behaviors and the 5-step routine, I need to give you one framework. Without it, the individual items will feel like a list of cautions rather than a coherent picture. I call this framework the morning cardiovascular surge. And understanding it transforms everything else I'm going to share. 3 things happen simultaneously in the cardiovascular system within the first 30 to 60 minutes of waking. 3 specific interconnected things, and all 3 matter for what follows. First, the autonomic nervous system shifts from parasympathetic dominance, the rest and repair mode of sleep, to sympathetic dominance, the alert, active state of daytime. This shift is driven by the release of catecholamines, primarily adrenaline and noradrenaline, which directly increase heart rate and cardiac output. In practical terms, your heart goes from its overnight pace to its daytime pace rapidly. In a cardiovascular system with good arterial compliance, meaning flexible, responsive vessel walls, this transition happens smoothly. In a system with arterial stiffness, which is common after 60, the same surge creates sharper pressure spikes. Second, cortisol, the primary stress hormone, reaches its daily peak within the first 30 to 60 minutes of waking. This is a normal biological pattern called the cortisol awakening response, and it serves a useful purpose. It mobilizes energy, sharpens alertness, and prepares the body for the demands of the day. But cortisol also raises blood pressure, increases blood glucose, and amplifies the cardiovascular response to any additional stressor. The morning cortisol peak means that anything that adds further stress to the cardiovascular system during this window has a magnified effect compared to the same stressor later in the day. Third, and this is the one most people never hear clearly explained, blood platelet activity and clotting tendency are elevated in the morning hours. Platelets are the components of blood that form clots to seal injuries. Their activity follows a circadian rhythm with peak aggregation tendency occurring in the morning. This is why the majority of heart attacks and strokes occur between 6 and noon, not randomly distributed across the day. The combination of elevated blood pressure, increased cardiac demand, and heightened clotting tendency creates a convergence of risk factors that is genuinely unique to the morning window. One behavior that amplifies any of these three factors, the sympathetic surge, the cortisol peak, or the clotting tendency, adds unnecessary risk to a system that is already under its highest daily load. Keep that framework in your mind as we go through each behavior and each protective step today. I want to ask you something. Think about your morning, not today specifically, just your typical morning over the last few years. How long does it take from the moment your alarm goes off to the moment you are fully upright and moving? A few seconds? Do you start the day with strong coffee before eating anything? Have you noticed that mornings sometimes feel different from the rest of the day? A little more unsteady, a little more breathless on exertion, a little more aware of your heart? Most adults over 60 notice something has shifted about how mornings feel, not dramatically, not in a way that necessarily triggers a doctor's visit, just a quiet awareness that the first hour of the day requires a little more care than it used to. That awareness is not anxiety, it is your body accurately signaling that something has changed, and that the morning transition that happened automatically at 40 is now something that benefits from a little more intentional support. If any of that resonates with you, this conversation was made for your specific situation. Here is what I need you to understand before we go through the list. The morning cardiovascular changes I just described are not pathological. They are normal biology. What creates risk is not the surge itself. It is layering additional cardiovascular stressors on top of a system that is already at its daily peak of demand. Remove those additional stressors, and the same morning transition becomes considerably safer. That is what today is about. Before we go deeper, my free longevity guide, which covers protective daily routines for cardiovascular health and healthy aging across multiple body systems, is linked in the description below. Grab it now and follow along with today's material. Let me explain the specific biological mechanism that makes the morning window uniquely vulnerable for older adults, because once you see this clearly, every behavior on today's list will make immediate physiological sense. Picture the cardiovascular system as a hydraulic network. During sleep, that network operates at low pressure and low demand. The pump, your heart, beats slowly. The pipes, your arteries, are relaxed. The fluid, your blood, is moving gently and at reduced viscosity because body temperature is slightly lower overnight and clotting factors are at their daily minimum. Now imagine that network receiving a signal to go from low pressure to high pressure within minutes of waking. The pump speeds up, the pipes constrict slightly in response to adrenaline, the fluid thickens slightly as clotting tendency rises. All of this is happening simultaneously in a coordinated way as part of normal morning physiology. In a young, healthy cardiovascular system, the pipes are flexible enough to accommodate the pressure change smoothly. The pump is strong enough to handle the increased demand without strain. The regulatory systems, the baroreceptors that monitor pressure, the endothelial cells that release nitric oxide to relax vessel walls, are responsive enough to buffer the transition. After 60, several of these buffers are less robust. Arterial walls that have been exposed to decades of pressure, inflammation, or elevated blood sugar become stiffer and less compliant. Baroreceptor sensitivity, the system that detects and responds to blood pressure changes, declines. The endothelial cells that produce nitric oxide become less responsive. The result is that the same morning surge produces sharper pressure spikes, takes longer to regulate, and occurs in a vascular system with less margin to absorb it. Add to this the fact that most people wake up mildly dehydrated, losing 1 to 2 guidance. 2 adjustments make morning coffee significantly less cardiovascularly stressful. First, drink water before coffee, which we have already covered. Second, delay the first cup by 30 to 60 minutes after waking, which allows the cortisol awakening response to begin subsiding before adding a caffeine stimulus. And if you eat breakfast, drinking coffee with or after food rather than before it reduces the absorption rate of caffeine and further blunts the cardiovascular response. This is not about eliminating coffee, it is about the sequence and the timing. Coffee after water, coffee after 30 minutes, coffee with food. 3 simple adjustments that preserve the enjoyment of your morning coffee while removing its amplifying effect on the morning cardiovascular surge. The common mistake is treating morning coffee as a neutral habit simply because you have done it for decades without noticing a problem. The cardiovascular changes of aging mean that the same behavior has a different physiological impact at 68 than it did at 48. The habit didn't change, the system responding to it did. Morning behavior 4, intense exercise immediately after waking. Exercise is one of the most protective things an adult over 60 can do for cardiovascular health. The evidence for regular moderate exercise reducing cardiovascular risk, improving arterial compliance, lowering resting blood pressure, and extending health span is among the most robust in all of medicine. This section is not an argument against morning exercise. It is an argument for when and how to begin it. The risk of intense exercise in the immediate post-waking period deserves an honest, nuanced look because the research here is genuinely mixed rather than uniform. What is well established and published in journals including Circulation, the flagship journal of the American Heart Association, is that sudden cardiac events in general, heart attacks, dangerous arrhythmias, sudden cardiac death cluster disproportionately in the morning hours across large populations. What is less settled is whether exercising specifically in the morning versus the afternoon changes an individual's risk during that session. Some studies of structured cardiac rehabilitation have found no significant difference in event rates between morning and afternoon exercise sessions. Other population-level research has found a higher rate of cardiovascular events among people whose physical activity clusters heavily in the early morning hours. Put together, the honest picture is this. The mechanism for concern is real and well-documented elevated platelet aggregation, peak sympathetic activation, residual dehydration, and in some cases orthostatic blood pressure changes, all present simultaneously before the body completes its transition into full daytime function. But the practical risk of morning exercise itself, for most people, is modest rather than dramatic. Where it matters most is for adults with underlying coronary artery disease or significant known cardiovascular risk factors. High-intensity exercise during this window, a fast run, a vigorous cycling session, heavy resistance training, an intense aerobics class demands a rapid increase in cardiac output at the same moment the cardiovascular system is already under its highest morning stress load. For a heart with flexible, responsive coronary arteries and well-functioning cardiac reserve, this demand is manageable. For a heart managing any degree of coronary artery disease, significant hypertension, or arrhythmia, conditions that are common and often underdiagnosed in adults over 60, the same demand can precipitate an event that more gradual exercise initiation would not. Long-running exercise cohort research, including decades of work following large groups of adults through studies like the Harvard Alumni Health Study, consistently finds that habitual exercisers have significantly lower overall cardiovascular risk than sedentary adults. Some of that same body of research also points to a pattern worth knowing. The relative risk of a cardiac event is transiently higher during and immediately after a single bout of vigorous exercise, especially for people who exercise irregularly rather than habitually. The protective effect of exercise is real and large. The timing and intensity of morning exercise initiation modifies that protection. The practical guidance is not to skip morning exercise. It is to begin it with a genuine warm-up of at least 10 minutes. light walking, gentle stretching, low resistance movement before increasing intensity. Allow the cardiovascular system to transition gradually into exercise demand rather than imposing maximum demand from the first moment of activity. And if you have been sedentary and are beginning a new exercise routine, morning is not the optimal time for the initial high-intensity sessions. Midday or late afternoon exercise carries less cardiovascular risk during the initiation phase. The common mistake is treating warm-up as optional, something to abbreviate when time is short. In the morning cardiovascular context, warm-up is not optional. It is the transition period that allows the heart rate, blood pressure, and coronary blood flow to scale up gradually before high demand is placed on the system. Now let me address the fifth morning behavior. And I want to approach this one carefully because it involves a practice that has been popularized in wellness culture and associated with numerous health benefits, some of which are real. The question is not whether cold water exposure has any value. For some people, in some contexts, it does. The question is whether an ice-cold shower immediately after waking is the appropriate application of that practice for adults over 60 managing cardiovascular risk. Morning behavior 5, an ice-cold shower immediately after getting out of bed. The cold shower trend has reached a point where it is presented in many wellness spaces as an essentially universal health intervention, energizing, anti-inflammatory, mood-boosting, and cardiovascularly strengthening. Some of these claims have research support for younger, healthy populations. The picture is considerably more nuanced for adults over 60 with cardiovascular risk factors. Here's what happens physiologically when the body is exposed to cold water. Cutaneous blood vessels, the vessels near the skin surface, constrict rapidly and dramatically in response to cold temperature. This is called cutaneous vasoconstriction, and it serves a protective purpose. It redirects blood from the skin surface to the core organs to preserve core body temperature. The cardiovascular consequence is an immediate sharp rise in blood pressure as the peripheral vascular resistance increases suddenly. Simultaneously, the cold stimulus activates the sympathetic nervous system, producing a rapid increase in heart rate and cardiac output. The combination of sharply elevated blood pressure and increased cardiac workload is what the research refers to as cold pressor response. In healthy young adults with compliant, responsive arteries, the cold pressor response is transient, well-tolerated, and resolves quickly. In older adults with arterial stiffness, in people with hypertension, and particularly in people with coronary artery disease or known arrhythmia, the same cold pressor response produces a more exaggerated blood pressure spike, a greater increase in cardiac workload, and a cardiovascular stress that can, in susceptible individuals, trigger angina, arrhythmia, or in rare but documented cases, more serious cardiac events. Case reports and clinical reviews, including those published in the International Journal of Cardiology, have documented cold water immersion as a trigger for cardiac events in susceptible individuals, with the mechanism being cold-induced coronary artery spasm, elevated blood pressure, and the increased oxygen demand of a heart working against higher peripheral resistance. Researchers describe such events as uncommon in the general population, but note the risk is meaningfully higher in individuals with pre-existing coronary artery disease, uncontrolled hypertension, or known cold hypersensitivity. Now consider the morning context. An ice-cold shower immediately after waking means applying a significant cold pressor stimulus, one that sharply elevates blood pressure and cardiac workload. During the morning window, when blood pressure is already naturally elevated, the sympathetic system is already maximally activated, and clotting tendency is at its daily peak. For a cardiovascular system managing risk factors that are common in adults over 60, this is layering a significant additional stressor on top of an already demanding baseline. This is not a claim that cold showers routinely cause cardiac arrest in healthy older adults. That would overstate the evidence and create unnecessary fear. What the evidence does support is that cold water exposure immediately after waking represents a disproportionate cardiovascular stressor during the highest risk window of the day, one that is easily avoided without giving up the benefits of morning showering, and that adults with known cardiovascular conditions should specifically discuss with their physician before adopting. The practical guidance is clear. If you shower in the morning, use warm or comfortably cool water rather than ice cold. If you wish to include cold water exposure for its documented benefits, which include improved alertness, reduced muscle soreness after exercise, and modest improvements in mood, consider doing rounds of water overnight through respiration and perspiration, which means the blood is slightly more viscous and the blood volume is slightly reduced at exactly the moment the heart is being asked to increase its output. The pump is working harder with less fluid in the system. That is the baseline vulnerability of the morning window. Now let me show you the 5 behaviors that make it worse and the 5 steps that make it better. I have ordered the 5 behaviors from common and frequently misunderstood to most physiologically significant. The 5th is the one that will genuinely surprise most people. And I want to be clear throughout, these are not behaviors that will reliably cause a cardiac event in a healthy person. They are behaviors that elevate cardiovascular stress during a window when the system is already under its highest daily demand. And for adults managing heart disease, arrhythmia, hypertension, or significant arterial stiffness, that distinction matters meaningfully. Morning behavior 1, jumping out of bed immediately after your alarm. Arthur was 68. He had been getting out of bed the same way for 40 years. Alarm goes off, feet on the floor, upright within seconds. He was efficient, practical, and had no reason to question a habit that had always worked fine. One morning, he stood up quickly and felt a wave of dizziness that made him grab the nightstand. His blood pressure had dropped sharply on standing. Most people assume that getting up quickly is simply a habit with no physiological consequence. That assumption is worth examining. When you transition from lying to standing, gravity pulls blood downward into the lower limbs. In a fraction of a second, the baroreceptors in your neck and aorta detect the sudden drop in pressure at the brain and trigger a compensatory response. The heart rate increases, the blood vessels constrict, and blood pressure is restored. This response is called the baroreflex, and in a young, healthy cardiovascular system, it happens so fast you never notice it. After 60, baroreflex sensitivity declines. The response is slower and less precise. The result is orthostatic hypotension, a temporary drop in blood pressure upon standing that can cause dizziness, lightheadedness, or in more pronounced cases, a fall. The American Heart Association identifies orthostatic hypotension as a significant risk factor for falls, syncope, and cardiovascular events in older adults, with prevalence estimates suggesting it affects 20 to 30% of adults over 65 to some degree. Now add the morning context. Cortisol is peaking, the sympathetic system is already activated, and the blood is slightly thicker from overnight dehydration. Standing quickly under these conditions amplifies the baroreflex challenge at the worst possible moment. Research published in the Journal of Hypertension found that in older adults with hypertension, the blood pressure variability and the magnitude of orthostatic blood pressure change were both significantly greater in the morning hours compared to the afternoon, confirming that the morning window creates measurably greater cardiovascular demand during postural transitions. The practical guidance is straightforward. Do not stand immediately after waking. Sit on the edge of the bed for 60 to 90 seconds before standing. Allow the cardiovascular system to begin its morning transition while you are still supported. During those 60 to 90 seconds, take 3 to 5 slow controlled breaths, which we will discuss in more detail in the routine section. Then stand slowly, holding the nightstand or headboard if needed, and pause for another 5 to 10 seconds before beginning to walk. This does not need to be a formal procedure. It takes less than 2 minutes, and within 3 to 5 days of adopting it consistently, most people notice that the first moments of standing feel more stable, that the dizziness or lightheadedness they had accepted as normal in the mornings decreases or disappears, and that they simply feel steadier and more oriented at the start of the day. The common mistake is treating this as advice relevant only to people who already experience dizziness. Orthostatic hypotension is often subclinical, meaning it is occurring physiologically without producing symptoms the person identifies as dizziness. The protective value of a slow rise exists whether or not you currently notice the consequence of a fast one. The next behavior operates through an entirely different mechanism, and it involves something most people consider protective rather than risky. Morning behavior 2, not drinking water before anything else. Most adults wake up mildly dehydrated. This is not a failure or a sign of poor health. It is a predictable consequence of 6 to 8 hours of breathing, perspiring, and metabolic activity during sleep. Without fluid replacement, the average adult loses approximately 1 to 2 pounds of water overnight. For a 150-pound adult, that represents roughly 0.5 to 1.3% dehydration, mild in absolute terms, but physiologically meaningful in the morning cardiovascular context. Here is why it matters specifically at this time of day. Blood volume and blood viscosity, how thick or thin the blood is, are directly affected by hydration status. Thicker blood requires the heart to work harder to pump it. It also flows less smoothly through the coronary arteries and the small vessels of the brain. Research on hydration and blood rheology, including studies in aviation and environmental medicine, has consistently shown that even a few hours of mild fluid loss measurably increases whole blood viscosity, and the elevated platelet aggregation that is already present in the morning hours, on top of that thicker blood, is exactly the kind of compounding effect that makes the morning cardiovascular risk window what it is. For adults taking blood pressure medications, diuretics, or medications that affect kidney function, overnight dehydration may be more pronounced than in the general population, and the morning cardiovascular impact correspondingly greater. This is not medical advice for your specific medication situation. That conversation belongs with your physician, but it is a reason to raise the topic of morning hydration at your next appointment if you are on any of these medications. The practical guidance: before coffee, before breakfast, and ideally before getting out of bed if you keep water on your nightstand, drink 8 to 12 ounces of water. Room temperature or slightly warm water is absorbed more rapidly than cold water and is gentler on the digestive system first thing in the morning. If you find plain water difficult to drink immediately upon waking, a small squeeze of lemon makes it more palatable without affecting its cardiovascular benefit. Within 3 days of adding morning water consistently before anything else, most people report reduced morning headaches, less morning stiffness, and a clearer mental state within the first 30 minutes of the day because the brain, which is approximately 75% water, is among the first organs to benefit from morning rehydration. The common mistake is reaching for coffee first. Coffee is mildly diuretic, meaning it slightly promotes fluid loss, and starting the day with coffee before water means beginning your highest cardiovascular demand window in a slightly dehydrated state that has then been mildly worsened rather than corrected. The sequence matters: water first, then coffee. Pause here for a moment. Has your doctor ever specifically talked to you about your morning routine in the context of your cardiovascular health? Not just your medications, your exercise habits, or your diet generally, but the specific window between waking and the first hour of the day? Drop a yes or no in the comments. This is a conversation that almost never happens in a standard cardiology or primary care appointment, and yet the evidence for its relevance is clear. Morning behavior 3. Strong coffee on an empty stomach. Let me be precise here, because coffee itself is not the enemy. The research on moderate coffee consumption and cardiovascular health in adults over 60 is actually reasonably positive. What creates elevated risk is the specific combination of strong coffee consumed on an empty stomach during the morning cortisol peak in a person whose cardiovascular system is already navigating its highest demand transition of the day. Here is the mechanism. Caffeine directly stimulates the sympathetic nervous system, the same system that is already activated to its daily maximum during the morning cortisol surge. It increases heart rate, raises blood pressure, and increases cardiac output. In the afternoon, when the cortisol awakening response has subsided and the cardiovascular system is in its more stable daytime state, a cup of coffee adds a modest, manageable stimulus. In the first 30 minutes after waking, when cortisol is already peaking and the sympathetic system is already fully engaged, the same cup of coffee is not adding a modest stimulus. It is amplifying an existing surge. Research on caffeine and blood pressure consistently shows that caffeine's pressor effect, its ability to raise blood pressure, is well established and tends to be more pronounced in people with existing hypertension or elevated cardiovascular risk. And physiologically, that pressor effect is layered on top of a system that, in the first hour after waking, is already running its own sympathetic surge. Two stimuli acting on the same pathway at the same time add up rather than cancel out. For people on beta blockers or other heart rate modulating medications, the interaction between morning caffeine and morning sympathetic activation is worth a specific conversation with your physician. After the first hour of waking has passed and the morning cardiovascular surge has subsided, and begin with brief cool rather than ice-cold exposure, gradually acclimating rather than beginning with maximum cold intensity. The common mistake is assuming that if a practice is healthy for one population at one time of day, it is equally healthy for all populations at all times of day. Cold exposure research is largely conducted on younger, healthy populations, and the morning cardiovascular context for adults over 60 is genuinely different. The practice is not categorically dangerous. The combination of maximum cold intensity immediately upon waking in a person managing cardiovascular risk is the specific pattern that deserves reconsideration. Now let me give you the other side of this conversation, because understanding what to avoid is only half of what matters. The other half is understanding what to do instead, and the 5-step morning protection routine I am going to describe now is not a made-up protocol. Every step of it is grounded in the same physiological framework I have been building throughout this video. The morning protection routine takes approximately 5 to 7 minutes in total. It does not require any equipment, and it is designed specifically to support the cardiovascular system through the morning transition, reducing the peak of the blood pressure surge, supporting baroreflex function, correcting overnight dehydration, and allowing the sympathetic activation to proceed more gradually rather than more sharply. Step 1. Wake slowly and do not move immediately. This step begins before you sit up. For 60 to 90 seconds after your alarm, stay lying down. Not because movement is dangerous, it isn't, but because this brief pause gives your cardiovascular system its first cue to begin the morning transition gradually. During this time, take 3 to 5 slow controlled breaths. Inhale for 4 counts, exhale for 6. The extended exhale specifically activates the parasympathetic nervous system, the calming, regulatory counterpart to the sympathetic surge, and has documented effects on reducing heart rate and blood pressure variability during the morning transition. Research on controlled breathing and heart rate variability consistently shows that even 2 to 3 minutes of slow, controlled breathing in the immediate post-waking period significantly moderates the cortisol awakening response and reduces the amplitude of the morning blood pressure peak. You are not eliminating the morning surge. You are smoothing it, reducing the sharpness of the spike while allowing the normal transition to proceed. Multiple randomized trials on slow breathing techniques and morning blood pressure have demonstrated consistent reductions in systolic blood pressure of 5 to 8 millimeter Hg with regular practice of morning controlled breathing, a reduction comparable to a modest medication adjustment achieved in under 2 minutes with no side effects. Step 2. Sit up and drink water before standing. Sit up slowly, using your arms to push rather than pulling up abruptly with your core, and reach for the water you placed on your nightstand the night before. 8 to 12 ounces, room temperature. Drink it before you stand. This step accomplishes 2 things simultaneously. It begins correcting overnight dehydration before the cardiovascular system is asked to increase its output. And it gives you another 60 seconds of seated time that allows your blood pressure to stabilize in a supported position before the postural challenge of standing. If you take morning medications, this is the moment to take them with your morning water before you stand up. Step 3. Sit on the edge of the bed for 60 seconds before standing. Move from lying to sitting, then sit on the edge of the bed with your feet on the floor for a full 60 seconds before you stand. This is the transition step that directly addresses orthostatic hypotension risk. It allows the baroreceptors and the peripheral vascular system to begin adjusting to the upright position before the full gravitational challenge of standing is added. During this 60 seconds, do 3 to 5 gentle ankle pumps, flexing your feet up and down slowly. This engages the calf muscle pump, which is sometimes called the second heart, because it assists the return of blood from the lower limbs back to the heart against gravity. Activating the calf pump before standing reduces the amount of blood that pools in the legs during the postural transition and supports a more stable blood pressure response to standing. Step 4, stand slowly and stretch gently before walking. Stand using a deliberate, unhurried motion and hold the nightstand or headboard for a moment as you do. Once upright, stand still for 5 to 10 seconds and assess your stability before beginning to walk. If you feel lightheaded, sit back down, take 3 controlled breaths, and try again after another 60 seconds. This is not a sign of a problem. It is your baroreceptor system communicating that it needed a little more time. Once you are standing stably, spend 60 to 90 seconds doing gentle morning stretching, arms overhead, side bends, slow neck rotations, gentle forward bends. This serves 2 purposes. It begins activating the large muscle groups in the legs, back, and core, increasing circulation gradually before any significant demand is placed on the cardiovascular system. And it stimulates baroreceptor function through the gentle changes in position, helping to calibrate the blood pressure regulation system for the day ahead. Step 5. Begin the day with deliberate, gradual activity rather than immediate high demand. The final step of the morning protection routine is not a specific action. It is a principle applied to the first 15 to 20 minutes of your day. Whatever your morning involves, making breakfast, getting dressed, caring for others, beginning work, approach the first 15 to 20 minutes at a pace that is deliberately unhurried. Walk rather than rush. Dress without time pressure where possible. Allow your cardiovascular system to continue its gradual transition into full daytime activity rather than imposing maximum demand the moment you are on your feet. Research on the morning cardiovascular window consistently shows that the risk associated with morning activities is greatest in the first 30 minutes after waking and decreases significantly over following 90 minutes as the body completes its physiological transition. You are not trying to protect yourself from the entire morning. You are giving the first 30 minutes the care it genuinely deserves. Before your 30-day challenge, here is a tool for your next cardiology or primary care appointment. I call it the Morning Heart Safety Protocol. 5 questions worth raising specifically in the context of your cardiovascular health and morning routine. Question 1, based on my current cardiovascular status, my blood pressure pattern, any arrhythmia history, and my coronary artery health, should I be taking any specific precautions during the morning cardiovascular window? Question 2, are any of my current medications affecting my blood pressure variability or baroreflex response in the morning specifically? And is my morning medication timing optimized for cardiovascular protection? Question 3. Do my blood pressure readings tend to be highest in the morning? And if so, is my current treatment adequately addressing that morning surge rather than just my midday or evening readings? Question 4. Given my cardiovascular history, is there any form of cold water exposure, showers, swimming, outdoor cold that I should specifically discuss before continuing or starting? Question 5. What type and intensity of morning exercise is appropriate for my current cardiovascular status, and would a cardiopulmonary exercise test or stress test help clarify the safe upper limit of my morning exercise intensity? Any cardiologist or primary care physician focused on your long-term cardiovascular health will welcome these questions. The morning cardiovascular window is real, well-documented, and worth a specific conversation about your individual risk profile. Here is your 30-day challenge. It is specific, trackable, and designed to be achievable without any disruption to your existing morning schedule. Starting tomorrow morning, adopt the 2 easiest steps first, 60 seconds of slow breathing before getting up and a glass of water before coffee. Just those 2. Write down your starting blood pressure if you have a home monitor, or if you don't, write down how your mornings typically feel on a scale of 1 to 10 for steadiness, clarity, and energy within the first 30 minutes of waking. Do those 2 steps every morning for 30 days without exception. At day 15, add the 60 seconds sit on the edge of the bed before standing. At day 22, add the gentle ankle pumps and the brief morning stretch. By day 30, the full routine is in place. Check your baseline numbers again at 30 days. If you have a home blood pressure monitor, compare your morning readings from the first week to the readings from the final week. Most people who consistently adopt a gradual morning routine see a measurable reduction in morning blood pressure peak, often in the range of 4 to 8 millimeters of mercury, without any medication change. That reduction in the context of the morning cardiovascular window is clinically meaningful. The 30-day time frame matters because behavioral habits require consistent reinforcement before they become automatic. The first week takes deliberate effort. By week 3, the routine begins to feel natural. By week 4, it has become the new default, and the cardiovascular benefit is accumulating with every morning it is practiced. There is a difference between medicine that treats cardiovascular events after they occur and medicine that protects the cardiovascular system in the daily moments when it is most vulnerable. After 60, those two things, reactive treatment and proactive protection, are not equally effective, equally affordable, or equally kind to your quality of life. The morning cardiovascular window exists whether or not you are aware of it. The biology does not change based on whether you know about it, but what you do in that window, how quickly you rise, whether you hydrate before anything else, how you sequence your coffee, how you initiate exercise, and whether you apply cold water stress to a system that is already under its highest daily demand, all of it either adds to the morning cardiovascular burden or reduces it. 5 small choices, none of them requiring a prescription, none of them requiring equipment, none of them taking more than a few minutes collectively, but each of them operating precisely on the biological mechanisms that make the morning window matter. In 21 years of working with adults over 60, I have watched people make these 5 changes and describe something I hear often and always find meaningful, that mornings simply feel different, steadier, calmer, less effortful at the start, not because anything dramatic changed, but because the cardiovascular system was finally being asked to do its morning transition with support rather than in spite of additional stress. That is what you now have. The understanding of why mornings are the highest risk window, the 5 behaviors that amplify that risk unnecessarily, and the 5-step routine that reduces it one quiet morning at a time. You are not helpless in front of your cardiovascular health. You never were. But now you have 5 specific things to change, a specific protocol to adopt, and the biological reasoning that makes every step of it make sense. That is a meaningful shift. Use it. If this gave you something useful today, subscribe. This is what this channel is for: calm, science-based, evidence-grounded guidance for adults who want to protect their health with information they can trust and use. The longevity guide is linked in the description. Download it, share this video with someone whose mornings and heart health you care about, and I will see you in the next one.